The following video is to help train staff in Tees Esquire Valley's NHS Foundation Trust in the importance of PROMs and specifically SWEMWBS and how they can be used correctly in clinical practice. I'm Adam Tivernan, not only a service user within TUV, but also a member of their Experts by Experience group. I want to show how important SWEMWBS, which stand for the Short Warwick Edinburgh Mental Wellbeing Scale, how important they can be for us the service user and use the clinician in building that all-important relationship, which is vital in helping us on our recovery journey. SWEMWBS are used to monitor our well-being from our perspective and what impact, if any, your interventions have had. We need to move away from this just being a ticky box exercise. If you don't believe in the importance of this paperwork, then how can we believe in the importance of it? Another really important part of the SWEMWBS is enabling us, as service users and yourselves, to plan our care together, which is vitally important going forward in our recovery journey. We need to be validated, we need to be listened to, and this is one of the steps that can be taken to help us achieve that together. We need to look towards the recovery goals of CHIME: connectedness, hope, identity, meaning and empowerment. And with this form being completed correctly and filled in together, that is very possible. It is your responsibility as staff members to ask us how often we would like to complete the SWEMWBS form, be it as frequently as we would like, or every time we come in for meetings and reviews. It is vitally important that you ask us whether we need help or assistance to complete the forms, or whether or not we are able and more than willing to complete it ourselves. We need to work together throughout this process and to find out and to achieve what is best for the service user. The following film is not a depiction of anybody's personal stories or personal experiences. It is purely made up for the purposes of training.
Okay, Sharon, thanks for giving us all that background information, and we've confirmed who you are, where you live and things like that. There's lots of questions that I would like to understand about how things have been for you. One of the documents that we sometimes use to help us with that is called the Short Warwick and Edinburgh Mental Wellbeing Scale.
I'm not interested.
No.
I'm not doing that.
No. Can I ask why?
Because it's just going to end up in a file somewhere. No one's going to look at it.
Okay.
I've done loads of them before. It's just a waste of time.
People have not looked at them with you.
Oh.
Right.
You fill them in, you might as well just put them in the bin.
Right, okay. I'm sorry that you feel that way, and I'm sorry that you've been treated that way with them. The areas that are on there, and you can refute, you can decline to use it. I'm not saying that you have to use it and it won't affect your care, but the reason that I really like the document is these are areas that I'm going to ask you about in any case, and I'm going to form my judgment about where I think you are. And
Will you just fill it in then?
Okay. Well, I could complete a rating scale from my perspective of what I think's wrong, but I'm more interested in what you think's wrong. And all the areas are areas I am going to ask about, and I'm just wondering if we could put a rating to them so you can explain to me from your perspective what areas you think are a problem and what areas aren't.
Right, well you tick the boxes and I'll answer your questions.
You sure?
Yeah, go on then.
Yeah, we'll give it a go then. I mean, you've talked to me about feeling agitated and isolated previously. So in terms of feeling relaxed from none of the time to all of the time, we've got none, rarely, some, often, and all. Where would you say you were in terms of feeling relaxed?
Probably rarely.
Rarely.
It's like some of it, rarely.
Rarely. Okay. And I know you're not happy being here today, and I know that the experiences you've had have affected how you're feeling. But in terms of the future, what are you thinking about the future? Does it look good? Are you optimistic about it? It's the same rating from none to all of the time.
None.
None of the time. So you're telling me you can't really see future? No. I'm sorry to hear that. I'm hoping that that's something we can help you with. I know you don't feel we've helped in the past, but I'm hoping it's something we will be able to help you with. Feeling useful, how are you spending your days?
Again, none, none.
Don't feel useful at all?
No.
No.
I don't do anything. I spend most of my time just in bed wishing I wasn't here. It's obviously none of the time.
Okay. Is there anything you think we can do to change that? What do we need to do to help you?
I don't know, fix what's going on up there.
Okay, tell me what's going on up there.
Well, there's just so much noise all the time. Like, I can't concentrate on anything. I just feel rubbish all the time.
Okay. So in terms of thinking clearly, then you can't think clearly any of the time?
No.
Yeah. Tell me again what's going on up there. I really want to understand it, that's why I'm sticking with it, because I want to understand what it's like from your perspective.
It's just like a non-stop, like a description of things that are going on around me all the time in my head, so I can't focus on like anything because it's just like noise all the time.
Noise and voices, like commentary telling you what's happening.
It's not anyone else's voice, it's just my voice, but it's like a constant commentary. I can't like grab onto anything because it's just going round and round. It just feels like a whirlwind in my head.
That can't be nice.
No, it's not. I'm sick of it.
Not all service users will immediately want to complete the SWEMWBS. The care coordinator will be expected to explain its use and, where possible, incorporate it into the clinical interview. The individual statements that make up SWEMWBS are areas that clinicians ask service users about all of the time. Please consider this when deciding whether the form is clinically inappropriate to offer or the service user has declined. Service users have the right to decline completing the measure, but please bear in mind the ability to incorporate the questions into the clinical interview and only record patient declined or clinically inappropriate to offer if you have been unsuccessful in gaining the service user's ratings. As you can see, even in challenging interviews, valuable information can be gathered. It's worth taking the time to explain the benefits and trying to engage with the service user to rate their perspective of their needs.